The study I just presented was one of the part of education of healthcare professionals, and it is conducted in Fukuoka City. The Fukuoka City is the 5th biggest city in Japan, and they declared that they will be the geriatric friendly city about 4 or 5 years ago, and they decided to have the Humanitude project in this project. So we started to work with them for 5 years, and including emergency medical personnel. And the training is done to the healthcare facilities or family caregivers or citizens and the paramedics. And clinically, it is very important to have the paramedics involved, because there are many elderly citizens in the city, and some have with dementia, and some lives alone, or some with so elderly is taking care of the elderly. So it's very difficult condition. And when they are in the emergency situation, the paramedics arrive the house, but they refuse to get on the ambulance car. So that there is some negotiation or discussion or something to bring them to the emergency room, and they are easily agitated during the transfer. So when they are so much agitated, when they arrive the emergency room, there's no other way to have the physical restraint, and which can start the vicious cycle of the healthcare of the person. So the paramedics really wanted to change the situation. Then I was asked to teach them. So this is the background of study. And another thing I'd like to show is how we teach the training. So this is how we did the training. This is a local TV news. This is before the training, and I took the video. And the camera is by the simulated patient. So this video shows how the patient sees.
患者の目線で撮られた研修前の映
He's
像で
talking
す。
to the person,
患者の視界
but
に
suddenly,
複数の人が一度に入ってきて、
you know,
どの隊員とも目線は合っていま
nobody
せん。
makes the real contact with the
ユマ
person.
ニチュード講座での実技、どの隊員
So
とも目
there's no
線は合っていま
significant
せん。
communication to the person. But this is after the training. So the person tried to have the eye contact
一
and
方、
continue
研
to
修後
talk.
は隊員の一人が患者の正面からゆっくりと丁寧に話しかけ、目線が合っているのがわかります。
This is what we have done for past four years, and we wanted to do some research, the clinical research for it. You know, the paramedics have the challenge to perform their duty promptly because the difficult communication with the dementia patients. So we developed the study, and the research question is if we teach the Humanitude training for the healthcare professional paramedics, can we analyze by artificial intelligence, and does it work well? And design was the single arm, the pre and post study, and participants are paramedics, and intervention was a lecture and the hands-on workshop, and the evaluation was done by video using the artificial intelligence. So the interventions are the 3 hours lecture and the 3 hours times 2 hands-on workshop of Humanitude. And the lecture is basically starting with the knowledge about dementia. This is the study of the learning dementia, and the mechanism and the clinical manifestation of dementia. Everybody knows it, should know it. And number 2 and number 3 is the Humanitude training. So why the communication skill is important? It was taught in the the hands-on workshop, with the face-to-face interaction or verbal communication or touch interaction. This is the core of Humanitude. And the job-specific skill training workshop, as you saw in the TV. So it's a simulation training by paramedics. And this is the result. This is the before. And these points are made by artificial intelligence, so how the person is recognized. And sorry. And before the training, the paramedics approach to the right of the person, which is opposite side, to have the good communication. And there's no eye contact, and the communication is very fragmented. And this is after the training. They keep eye on the person and very closer, and never leave the eyes. And this is the result. As you see here, the distance is much more closer after the training, and the duration of eye contact is much more longer. So this is the change of the person, and as a result, 31 paramedics enrolled the study. And before the training, we have asked about the experience, and 88% had any difficult experience with dementia patients in their work. And the video analysis showed the significant change of interactive communication in the direction of approach, or eye contact, or the duration of mutual gaze. It was statistically significant. And more than 90% of the paramedics consider that it is very effective for their work, and 97% the participant recommended the training to the others. And so it was very helpful for them.